Linda is the CEO of the Center for Elders Independence, which provides a program of all-inclusive care for the elderly. And she currently serves as president of CalPACE. And I'm just going to ask everybody to take their seats and settle down. Great, thank you. All right. Linda Trowbridge is the president of CalPACE, the association dedicated to the expansion of PACE in California. So she's one of our own PACE providers and working on a state level. She's been involved strategically as an operational leader with national and regional health systems in areas that include acute care hospitals, physician groups, home care and hospice, long-term care, managed care, and more than 10 years in the continuum care for Kaiser Permanente. I'm going to hand the stage over to Linda Trowbridge to moderate our panel.
Thank you very much. I'm privileged to be here, and I love working in this space and have the same passion for changing the face of aging for everybody, whether you're poor, whether you're middle, or whether you're wealthy. The issues that impact seniors, in the end, all kind of come together as the same. There's no option that we're going to age, and that we start to do that from the beginning. And I love another person's comments that I work with, Nader Shabang, who often says, isn't it a shame that you're told when you're in college that these are the best years of your life and the rest of it's going downhill? And I think that all of us in the room who've experienced more of life than that would say that is absolutely wrong. So we just need to flip this perception and provide dignity to everyone, not classify them as poor or old or frail, but how do we classify them as elders where we can grow from them and learn from them and cherish and value them. So you've already heard from several previous folks about how much is currently underway, and that is pretty remarkable, and some of that is going to be described by these panelists as well. But if you look at it today, most of what we're doing is reactive. And so many people have brought up, what are we going to do to keep this problem from getting worse? You get somebody housed and two more are on the street ready to go. So one thing is we're going to have to work on some of those projects simultaneously while we get, as Josh Bamberger says, this first group of people off the streets in a year. There can be some simultaneous work going on that says, how do we address those that are nearly homeless, and then how do we really begin to come together to prevent this? And I believe that we can do that. There is no one solution that's going to solve everything. It isn't just housing with services. That there are all the people in the room. We are incredibly siloed, despite the number of meetings that we attend together where we try to come together. And I think it takes a lot of political will, and Robert brought that up. We've got to let go of our little world. And I'm going to share one quick story. When I was in the acute care world and the tobacco tax first passed, all that money was handed out, and I describe it kind of sarcastically as 10 cents to every hospital in the state, right? So in Alameda County, or in particularly in Oakland and Berkeley, the Altabates Summit Group, then only Altabates, the Providence, Merit, all the providers got together and said, hey, none of this money is going to help us accomplish anything. Can we look to the goal of this, and can we find something we can pull it all together and let it go? And we decided at that time it was for maternal services, prenatal services, especially to people who didn't have resources. And we all said, yep, we can do that. We're going to throw it in a pot. Who is the most able to provide this? We even got past all of those walls and that we're better or this or that and the other thing, and made a decision. And today, that still exists, and it existed at Merit Hospital. That was the place of choice for this program. And I just think we can emulate that again. We can come together. There's plenty for all of us to do. Doesn't mean we have to undo our organizations. It just means we begin to work together in a more coalesced way. And so that, I think, is what is most important. It's going to take a real political will to have the county, the city, and all the not-for-profits and people like Kaiser or other big philanthropists that want to help us solve this problem. So with that, I'm going to talk a little bit about what the panelists are going to do. So we're trying to move upstream to address the issues in order to provide displacement or to avoid displacement and homelessness, touching on the impact of the stressors of older adults, which is universal, and especially those who have really complex needs that span the social determinant side and the medical side. So we've asked the panelists first to give us their perspectives on the crisis and bring us up to speed on the work that they are already doing in their wheelhouses. And then we'll have an opportunity to talk a little bit about what the future could look like and what could a bigger way of, not that we're not collaborating, but how could we expand that and turn that into something different? And then we'll turn it into a Q&A for everybody. So first, let's see here, where is my first person? So you're going to have their bios already out there. And so then so I'm just going to introduce them quickly. Wendy, I've lost my piece of paper where this is. So I apologize. Got it. Yeah, so first, Tram, but it doesn't tell me where Tram is from, is going to present. From Alameda County Public Health Department will make his first presentation. Well, yes, because the notes aren't here. I'll let you introduce yourselves briefly. And so they're going to run their slides, they're going to make a presentation, then we're going to get into a couple of key questions, and then we'll open it up to the audience. So they'll each have about 6 minutes, and then we'll get questions at the end. Yes?
Hi everyone, so I'm Tran Nguyen with the Alameda County Public Health Department. I work in our Health Equity Policy and Planning Unit, and I'm just very honored to be invited and to be on this panel because I see actually a lot of colleagues from the county and from the community that are the real experts on these issues. And my role has really been sort of excited for the last panel because that's sort of what we do in our Health Equity Policy and Planning Unit, is to try to make the connections between our service providers, our community partners, and our county and city partners to get at the very upstream policy and resource issues that we can work together on. So I'm going to start just with sharing this slide that we use often to kind of center ourselves around our approach of leading with an equity lens. This approach allows us to place these current inequities, this housing crisis, within its historical context. And to kind of really be mindful of the historical and structural underpinnings, such as racial redlining and racial covenants, and the sort of the social determinants, right, that are rooted in the policies and decisions that have created the inequities that we see today. So we have been. Keep worrying that it's not going, but I guess it is. So we have been tracking some key trends around displacement in the housing crisis in our county in particular. This isn't comprehensive by far, but it is some of the data that I was able to pull last minute around some of the key trends that we see among seniors, as I don't need to reiterate, are facing high cost burdens, right? High poverty, and are being displaced to other parts of the county or to outside of our county. folks have been hearing a while now, the African American population and the decline that we've seen there. And also overcrowding. We've definitely seen in our census tract mapping a rise in overcrowding. And all of these, I didn't bring a heat map, but all of these, we've done GIS mapping to compare where we're seeing rising rents and rising evictions, and they all line up. Especially also around where we're seeing higher rates of morbidity and mortality, so poor health outcomes as a result. And I don't need to spend a lot of time. This is a health pathway chart that really, I think, aligns with the chart that Robert shared earlier around the housing stress, life stress framework, but really making that connection between the social determinants, housing, and how housing leads to poor health outcomes for individuals and communities. We've also done, so a quick background is that, I think one of our roles has been to try to make the case for the policy and resource investments that, along with partners, we can advocate for. And so we've tried to make the case, through epidemiology. And this is one of the things that we've done is looking at key health indicators that correlate with, this one shows the correlation with housing cost burden, so paying over 50%, right, severely cost burdened, and how that correlates highly with hypertension in this case. I don't have the chart, but we have also done it to show the high correlation with mental health, hospitalization, and then especially for children, asthma, ED visits, right? I don't need to talk about this, but our epidemiology unit has been working to look at current trends in the growth of the rising older population. So that was the 65 and older, and then 85 and older, even higher, right? And there's a presentation that they have on our website that looks at the correlation or the corresponding rise in Alzheimer's and other chronic diseases. I did want to share that I've been talking to some of our public health nursing staff. Michelle Burke is here from our Older Adults Healthy Results program to get a sense also, of sort of what we're hearing on the ground. So one of the things we've tried to do is do surveys, do focus groups and conversations with our programmatic staff to understand how the housing crisis has been playing out among our clients and our programs. And I wanted to just note that we're seeing anecdotally in our work, sort of the trends that Robert talked about, right? Like, so one of our nurses was talking to me about seeing a lot of seniors living in multi-generational poverty with their families. So I forget the exact breakdown, but there's a significant majority that live with families, right? And then 20 or 30% that live alone. So the issues of seniors that face sort of the same challenges that we see families there, that we see low-income renters, right, or low-income people in terms of their housing challenges. The seniors that live with their family members are facing those same challenges of rising rents, right, sudden rent increases, risk of eviction, also increasingly exposure to substandard conditions. I just have a minute. So let me speed along. I won't talk about the Older Adults Healthy Results program because Michelle is here, and that's her information if you want to find out more on our website. I'll spend my last minute talking about kind of the things that we're working on, very upstream things. So along with everything else that the previous panel discussed, my focus, and then a lot of our partners, it's also around sort of what are the tenant protection policies, right, that would keep people in their homes. And we've been working to support, tenant protection ordinances, rent stabilization improvements, so that tenants are able to both sort of have responsive policies that work for them to prevent these unreasonable rent increases, for instance, or to have a just cause eviction reason. I think the other thing too is that Oh, I also wanted to mention, kind of along the lines of benefits assistance, one of the things we're starting to work around is utilities access, right? Utilities, energy access, and how that's really tied to housing insecurity. And I think for our senior population, we're seeing so many examples of that, where as people have cognitive decline, they, are falling behind on bills or not keeping up with their PG&E bills, and then the impacts around, getting shut off or accumulating, late payments. Those are all play out in very, severe ways for older adults who have, medical needs, right? And so we're definitely looking at that and advocating at the CPUC and state level for protections around that. Finally, I guess my last point, I know I'm out of time, but to sort of reiterate on, again, my colleague Robert, Dr. Ratner's point about building on this idea of purpose and agency, I think, too, we want to really focus on how do we build power with communities that are facing these challenges, these inequities, that, we're advocating for the resources and the policy protections, along with coordinating the services, right? One of the small examples of that is, I don't know if David Motorsbach is still here, but we have a newish program called Voting Matters at the Health Department to connect and register, our clients, our residents to voting. And this year we did a small pilot with Healthcare for the Homeless to register people in the homeless encampments in Oakland. But, just a small example, but I think sort of what are ways to connect seniors, older adults, to, sharing their voices and to advocating for the need for extremely affordable housing in these larger tables, where housing investment decisions are being made.
Well, and to segue from that, seniors are incredibly willing to be advocates. In one of our sites, we have a group that call themselves the Gray Panthers. And they're not the official Gray Panthers, but they think so. And they are willing to jump on board and to gather up the troops around most anything. So it's a perfect segue into James Chagari's legal assistance presentation about some of the protections and where you can find some help.
Yeah, in 6 minutes. So my name is James Chagari. I'm the Executive Director at Legal Assistance for Seniors. Very quickly, we're an Alameda County-based nonprofit that provides free legal services to older adults, and we are also the county's health insurance counseling and advocacy program, which is unbiased Medicare counseling. Starting in 2017 is when Legal Assistance for Seniors really has started getting into housing law as a practice. A little late to the game, but better late than never, and we are currently expanding. So it's a pretty small, I'm gonna say all this and people are gonna get excited, and that's good, but we are definitely still resourcing up. So just to kind of put a little caveat on it. I'm an attorney, so I put a caveat on almost everything. And really, what are we bringing to this space that's different? And I think in defining what does service look like for legal housing protection is one-on-one representation, home visits, strong collaborations with other service providers to meet complex needs. If you walk away with anything from what I have to say, it's that if you think there's a legal issue involved, get it to us early. The law is a very reactive tool in a lot of ways, and so a lot of the frustration we have in the office, and we're a very effective tool, but we're very, very specific. And so the further we can move as the community that works with us and providers, the quicker you can get a case to our office, the more opportunities we have to intervene. And the second thing I'll say about that is that as a legal service provider, we are rarely the only solution that an older adult needs to be stably housed, to be living with independence. And so for us, collaboration, not only is it nice, it's absolutely critical, because in the thousands of seniors that I've worked with, I was trying to think back there, I cannot think of a single case where the legal intervention was the only thing that needed to happen. So I need everybody in this room to really work with us. I have a case example, and I think it's worth spending a little bit of time on. Older couple in their 70s, wife has a fairly catastrophic medical emergency that requires extended hospital stay. the couple starts having trouble covering their rent and do not have timely kind of response to the unlawful detainer that eventually gets filed against them. But in talking to family, they believe they have a place to go, and so do not fight the eviction and are focused on the medical need that is in front of them. The unlawful detainer goes forward without representation happening, and when they basically have nowhere to go, when they show up at family's doorstep, they are turned away saying that they're overwhelmed, they can't stay there, and they end up homeless. I use this example. If you look down that timeline, if you go to the end of it where they're homeless, me, Attorney Jim, there's not a whole lot I'm going to do there. I am not an appropriate tool at that point. You start moving upstream. Now the unlawful detainer has been filed, and you get in contact with an attorney. Okay, now there's something I can do. I might be able to buy them some time. I might even be able to keep them housed. Move it a little farther upstream. Maybe we see that there's issues in place. There's issues with housing, but there hasn't even been an unlawful detainer filed yet. Maybe my office then contacts the landlord and we start working something out to prevent the unlawful detainer from ever getting filed. Move it farther forward, even further, and not even talking about this example. Could we have put a power of attorney in place? Could we have put an advanced health care directive in place to get other supports in place to manage the household, while they're dealing with a medical emergency? And so that's kind of one small illustration, and this works in a lot of different ways. Elder abuse is another one, where case after case, by the time we typically get the case, the result is devastating for the older adult, and I can protect them moving forward, but restoration and restorative kind of justice is really hard to come across, and is not the typical result, I would say, in the cases and in my experience. You're stabilizing and you're moving people forward. And so in the legal sense, that's why moving upstream is so important. I am not going to talk about why prevention matters. There are people who have already presented who did a much better job of going through these statistics, and I think we all know we're in a crisis. And so what are effective preventative measures from the legal perspective? This first slide is kind of more focused on renters. And for older adults, I cannot emphasize prevention means more than preserving the four walls. It's a whatever it takes perspective, and that means looking at case management, looking at legal interventions, looking at what are the systems that we need to put in place to keep this senior housed, not for tomorrow, not for the next month, but permanently. And one thing that's coming into our office quite a bit that I think really needs to be stated is, if we're really just talking about money as an intervention, I'm really encouraged by all the programs I'm hearing that have started up, because a big frustration for us is a lot of stuff comes to our office that, frankly, if someone could just write a check, solves it. You don't need an attorney to write a check. And so, if an unlawful detainer, so many come to our door that it really is a money issue, and a lot of times revolving around a medical need or something that is a one-time. Having the ability to write a check, something like Keep Oakland Housed, or what Dr. Ratner was talking about, and just being able to write a check as a solution is becoming more and more critical, and is a better use of resources. You don't need an attorney to write a check. And then for homeowners, I really appreciated the comment of what we have so many seniors in our community that are property rich and cash poor, and what are solutions for those seniors. A lot of what is on the slide has already been discussed. Public benefits access. Are we making sure that these seniors are being linked to the public benefits that they have a right to? I'm going to put a little bit of a different spin. We have, on the second bullet point, I have 3 sub, and it's reverse mortgages, shared housing, and public benefits access. For reverse mortgages and shared housing, those are solutions, but being an attorney, and always, at this point, I'm used to being the rainy cloud in the room, I am totally pro shared housing, and I think we have to be extremely careful as to how we're doing matching, the legal consequences of what we're doing, the idea, I really cannot emphasize enough that moving slow, while we are in a crisis, moving fast through the shared housing space is not going to end up being a solution, and where it's going to come to my office is as an elder abuse case, or when our senior is being sued in employment law for back wages that they didn't even know they were an employer, they didn't even know they were a landlord. So once again, I am very pro shared housing, but there are a lot of pitfalls and a lot of things that need to be worked through to make sure that we're not putting an older adult in a situation that's worse than what they started with. And I think I can pretty much stop there for now. Thank you.
So thank you, and I would encourage us to continue to support James and their not-for-profit, because they can do so much if we can just add some resources to their bench. There just aren't enough resources there. So next we're going to have Natalie Woods from Human Good, formerly American Baptist Homes and another organization, and they do all kinds of great affordable housing and services.
Thank you. Thank you. I was reluctant to do this, but I'm
Talk
glad.
into your mic a little more.
Can you hear me? All right. I was reluctant to do this, and I'm so glad to be here. There's so many passionate people in this room, and so I appreciate being here. And I'm going to talk about the I Wish program that we have at Allen Temple Arms. Go off script a little bit. We have over 4 million people above the age of 65 living in poverty. Okay, that's according to the Department of Health and Human Services. And only 1.6 million of those receive subsidies. And unfortunately aren't able to age at home. And so you have an enormous amount of elderly on Medicaid or Medi-Cal here in California, particularly if they move into a nursing home, okay? But because of proposed cuts to Medicaid, the focus is now turned to helping seniors age in their home, okay? And that's what the I Wish program is about, helping seniors age in their home. Let me see if this is gonna work. Nope.
You can push the down button, point it towards the laptop.
I have to push it this way?
There you go.
All right, there we go. All right, and so I'm not going to spend a lot of time on this, but this was just about the process. There were 15 properties in California that received the grant. There. This is who we serve at Allen Temple. The majority of our residents are African American. These are some of our partners that we have. And a lot more every day. And this is how it's broken down. With so the point of the wellness nurse, what I do is just basic care for the residents. So with the model, you're sort of providing basic care and bringing those services to the home, okay, to prevent overutilization of emergency services, premature placement in nursing homes. And so having a nurse and an enhanced wellness director brings resources to the actual home community. You can look in here. This is what the roles are. And this is what we want the outcome to be. But the model is also based on, I think it's called SASH. That was initially in Vermont. And what they've been doing for a number of years is having the state of Vermont sponsor nursing in the home community, and service coordinators to help seniors that are in public housing and communities have these resources around them so that we can prevent premature placement in nursing homes, and providing them with all the care and stuff that they need in their home communities. And so that's what I Wish is about.
Thank you. I'll make a plug for these kinds of services that all affordable health or housing providers who have these intensive services are at risk. It's renewed every year. Even though the money exists in the state of California makes everybody go through this horrible process of wondering every year if it's going to continue or not. And there's an easy way to bring forward some legislation, which is coming soon. So we'll get out to everybody and say, please support that, so that the organizations are willing to invest and not fearful that they'll lose the funding for this program, because you can't do it with no money. So next is going to be Randy Morris, who is the Deputy Director for Alameda County Social Services Agency, and kind of brings a lot of these areas together. And he's working on our group that's trying to get us working together better.
All right, good afternoon, everyone, and I'm acutely aware that I'm the fourth and final presenter on the fourth panel and stand between you and lunch. So with that said, I will try to make this interesting and engaging. So yeah, we are a very, very large government county agency, about $1 billion, 2,600 employees, many hundreds of thousands of people served. We have 3 large operating departments: the Child Welfare Department, the Workforce and Benefits Administration, which was mentioned quite a bit today, which is where the public assistance programs like CalFresh and Medi-Cal, General Assistance, CalWorks, and the employment services are. And then I oversee the third department, which is Adult and Aging. And today, I'm only going to talk about 4 of the 9 programs that are in my department, and it is a mosaic of differently funded programs from different jurisdictions that we try within our own little department to get out of silos, and it's quite a challenge given the funding streams and the regulations and the audits that we go through to try to be more integrated even within our own department. The topic today that Wendy asked this panel to talk about is kind of looking at this housing crisis. Are there things we're actually maybe already doing that we really need to pay attention to so that we keep or increase our investments so that we stop some of the bleeding? And there are a number of things that are intended to be in place that maybe aren't just resourced well enough, that if they were resourced appropriately would do a better job upstream, which is the point of this presentation. So I'm going to walk through 4 of those programs. In-home supportive services was mentioned. For backdrop, for those who don't know, that required the state of California to go to the federal government many decades ago and ask for a waiver to say, can we use that Medicaid in California Medi-Cal program instead of using it to just pay for care when people go into institutions and hospitals and skilled nursing facilities? Will you, federal government, give us a waiver to allow California to take some of that Medi-Cal money and apply it to pay for in-home care? So a la in-home supportive services was put in place. Very large program. We serve about 24,000 people. About 60% of those who are in the program are over age 65. About 50% of the providers of in-home care live in the home of the recipient receiving the care. And then, kind of interesting, about 70% of those clients in IHSS have their Medi-Cal or Medicaid program because they're on SSI. So it's a large percent because of the link to disability. And we are growing dramatically. When I was promoted to this position 7 years ago, we had about 15,000 clients in the program, and now we're closing in on 25,000. We get about 600 new applications a month. So in theory, this program, if working well, would be a program that helps people age in place with care in their home, and that is a big, complicated program. And in my couple of minutes, maybe question and answer, we'll get into the complexities of how to have that program be more effective. The second program is Adult Protective Services. It is not, unlike IHSS, a federally mandated nor federally funded program. It took an act of state legislation in the late 90s to mandate that adult protection programs were in place in the state of California. Because of that, it lacks federal funding, federal oversight, loosely regulated. A couple points that I would like to make is I moved from the Child Welfare Department into aging 7 years ago, but there are a number of people in my department in the APS program that started in the program when it went into place in the early 2000s. And if you speak to them on the topic of today, back when the program started and you looked at the type of cases that APS was investigating, it was a rare exception that the issue at hand was housing. And today, almost 80% of the cases that come to our attention are housing. So it was a program that was not funded, regulated, created to deal with a housing crisis, but it is increasingly becoming a place people call to say this older adult is in crisis because of housing, and that creates quite a dilemma for us. The third of the 4 programs I want to speak to is Public Guardian. This is actually not a mandated program in California. It requires an act of the local county board of supervisors to pass an ordinance to say there needs to be one. Why that's relevant is therefore there is zero, I want to underline zero, state funding for it. Our board, and actually every county in California has one. I hold the court title of public guardian, not to be confused with public conservator, which is mental health court. Public guardian is the probate court, and on the topic of today's discussion, this is predominantly, almost exclusively, older adults with dementia, often been exploited by known caregivers, sometimes predatory third parties. Adult Protective Services is the primary referral source, and we get in under court order, and actually when ordered to be responsible for that person's care, we actually then inherit under court oversight placement responsibility. This is a very, very complicated issue that's getting increasingly complicated because so often people who get conserved and placed under our oversight actually live with other family, and we're often in a dilemma where we have to figure out what to do to deal with the court order to care for that particular older adult who has cognitive decline, at risk of potentially disrupting a family housing arrangement. And it is quite a conundrum that's really becoming quite a quagmire that we all have to deal with. And then the last program I want to speak to is the Area Agency on Aging. In the 60s, when Medicare and Medicaid was passed, that kind of eclipsed and overshadowed the passage of the Older Americans Act. No surprise with ageism in our community. But that program is a federal program. It flows through the California Department of Aging, and in California, it's up to local jurisdictions to decide whether or not to run it as a nonprofit or government agency. And in Alameda County, it's Alameda County and my department that oversees the Area Agency on Aging. There's two components to that program that touch on the issue of housing, and the first is the money, very, very meager money that flows through. I highlight this because many of the righteous comments that were made in the room today about you should have this, we actually have this, but it is just crumbs spread across an ocean because there's not enough funding. So I'd like to just highlight on the funding issue. We have about $7 million of federal funding. We have $1 million local match, thanks to advocacy by people like Wendy Peterson a few years ago, and the board said, okay, let's give them some more money. Measure A, our partnership with healthcare, and the board supporting some Measure A money. So it's actually about a $9 million program. It has case management, family caregiver support services, senior injury prevention programs like helping with grab bars and some accommodations in the home, a visiting program for some of the most isolated seniors, the health insurance program, which legal assistance has the contract, an information and assistance program, home delivered meals, and then just general legal assistance. So all of that is upstream services that, if funded appropriately, would likely chip away at the problem, but and I speak to the CBOs and Wendy as an advocate, it's so limited. So that is where we need to work. The second and last leg of the Area Agency on Aging is it is mandated to develop a plan for the most vulnerable seniors in your jurisdiction every 4 years. So I was actually up here a couple of years ago speaking about that planning process that involved a lot of people in this room, and we ended up identifying 6 priority topics. The plan was lifted up to the board and moved to the state, and of those 6 topics, housing was identified for the first time, no surprise, as a huge crisis that needed to be tended to. And I'm going to shift to the last slide to speak to sort of what we're doing on these efforts, including what we're doing in the council that got created out of that plan. So I'm not going to repeat what Robert said earlier. The IHSS Bridge program, I would like to highlight, because so many people in this world work in the Medi-Cal and healthcare delivery system and its safety net. This county, and most counties actually, because of the cost incentives, invest a lot of money in community-based organizations, health clinics, and hospitals, actually with money to pay people to handhold and help people apply with these damn cumbersome Medi-Cal applications, because it's in the interest of the county's bottom line to have people on Medi-Cal and not at indigent care. In-home supportive services costs almost bankrupts counties. So there's not financial incentive, and what that means is only those who can figure out how to navigate getting in-home support services can get in, and it's equally as complicated to navigate. So this partnership with healthcare services to try to create ways and incentives to help the community help people apply, particularly those who are homeless, is a pilot that Robert referred to, and that could be a whole panel presentation. In the Adult Protective Services Program, it is our new normal in the state of California that APS is being confronted with what to do with housing, and for reasons I can understand, everyone is explaining the issue at hand as abuse. It puts us in a position of having to go out and respond to things that we were not funded to do. We don't have any housing dollars. But what we did is, instead of just complaining and whining, is we worked in partnership with a lot of people in this room, including Dr. Margot Cushell from a couple of years ago, who presented, and we went to the state legislature and fought, and the legislature passed a pilot called APS Home Safe, and that is actually $15 million of money that's going to go out to a small number of counties to actually supplement APS programs to help better keep people housed at the point of crisis when we get contacted. That application is due at 5 o'clock Monday, so Wendy, if you see me tiptoe out of here, I'm going to make sure the application is buttoned up and we get the money. So I'm going to end with the age-friendly council. Quite a bit of public conversation with our Board of Supervisors. I will say, not to get too political and policy wonky, but I feel very proud working in Alameda County because it's a place where democracy works. This Board of Supervisors listens closely to the community, sometimes more than us county people. Hi, board aides. But it really works. And we spent a year trying to figure out what to do with that senior plan because the issue, the crisis, the worry about older adults was so serious. The board held a number of community hearings, and they ended up creating this age-friendly council and said, basically, keep the collaboration going, work with the community, public systems, stop being in silos, work together. And I have the honor of facilitating that effort that meets every month. And what came out of that is, in one of our updates to the Board of Supervisors a little less than a year ago, the board said, of all those plans, what are you doing about housing? Please, please, please prioritize housing. The iron's hot, money's about to get deployed. Please step up and speak on behalf of older adults for housing. And that led to a committee that has been up and running for a number of months. A lot of people in this room, our public partners, Linda, Robert, who presented, are big pillars in that. The community, Wendy's very involved, Jim is involved, CEI is involved. Those are the meetings she talks about. And we are at a point, we just had what we hope is our final meeting yesterday. We are going to move this recommendation to the Homeless Council that Linda spoke to, and hopefully lift up and bring to the board a set of priorities, which really a lot of thought went into looking at the complexity of the housing puzzle from upstream to downstream to emergency to, and what would we recommend to our Board of Supervisors who get in a horrible position of having to pick between a million advocates saying, fund this. What do we recommend as a way to triage and focus for the unique needs of older adults, which have a lot to do with accessibility and some other things that a lot of housing programs don't really do very well with. So that is moving. We will continue to keep that information transparent. The board is going to ask us to come back in early 2019 to present on a lot of this, so there's a lot of public discussion about it, and we look forward to continuing that work and hopefully seeing some action on some of the ideas that came out of that housing subcommittee. So that is, I think I then go know how to find me. There you go. All right, thank you.
So now we're going to ask the panelists, thank you. Just in 3 or 4 minutes, I'm going to pose 2 questions in the interest of time. And that is, you know, if each of you could just speak briefly to what your agency hopes to accomplish in the future to mitigate homelessness, moving upstream. So filling the gaps, ensuring, for instance, HUD definitions of homeless aren't a barrier, that we get rid of some of this bureaucracy that prevents things from happening easily. And then also, what do you need to be more impactful? What do we need to do as all of us together? How can we strengthen the collaboration, and do we need to expand beyond who we're collaborating with today? Kaiser's really the first private organization that has stepped up to sort of own this, and how do we leverage them and others in addition to all of these other not-for-profits that have been working in this space and fighting this battle for a long time. So with that, I'll just turn it over to, do you want to start, Randy, or?
You're the moderator.
Okay,
I'll do that.
We'll start with Randy.
So I heard 2 questions in there, and you know, what could we do? I want to lift something up that I see being my job title is assistant agency director. So I have to be thoughtful of, on behalf of the whole agency that serves from, you know, prenatal and birth to death and everything in between and poverty. That something that plays out, having spent 17 years in child welfare. I had the Medi-Cal program during the Affordable Care Act rollout, so I was dealing with a lot of the community on issues of Medicaid enrollment. we're doing a better job in this county, and I think in the state and in this country, of making sure that the voice of older adults get lifted up and brought forward so that what the needs are really heard and felt. But there's something really complicated with that, is that the very constituent group we're trying to make sure their voice directly gets to older adults, particularly the most vulnerable one, are often homebound, they have cognitive decline. So I think we need to continue to figure out a way to make sure we get to our elected officials, state, county, federal is a whole different conversation, to make sure that there's a balanced conversation. There are going to be decisions made. You've heard presentations today about new money that's going to be deployed, and if we don't advocate, it's not that older adults need to be more important than, you know, a homeless mother with a newborn baby, but what often happens is the money goes elsewhere and not to older adults. So I just think we need to figure out a way to make sure we are organized, we're thoughtful, but we don't accept second seat. So I think we really have to advocate when these decisions are being made so that a fair share of resources are deployed to this unique population that often doesn't get its fair share. I think that's a huge priority, and I think it's something we can do in large part to some of these convenings. We are better organized than we were a few years ago when Wendy, we had the first one and none of us knew each other. Now we all just talk and you can't get us to start the meeting. So.
Yeah, to piggyback on that, I think I'm new to this space, and I would love to connect and coordinate, because we have been part of. So one of the things that I'd like to see going forward is we have been part of an equity collaborative through the CASA process, right? Which I don't know if folks are familiar with the CASA regional housing kind of suite of policy recommendations coming out of the kind of the MTC convened process. Really big. Supervisor Carson is a steering committee member of that, but a lot of very upstream housing investment decisions being made, and I always see extremely low income issues not even on the radar, right? Homelessness is not even on the radar, because I think folks don't really know how to wrap their heads around that, and it's really all about building and production of housing. So many places where I see the need to really provide the on the ground sense of how does this play out, and how can these resources that are coming down the pike, because our region is really, I think a lot of folks are getting it, right, that we need to do something about the housing crisis. So how do we tailor and talk about these investments in a way that will then work for the most vulnerable communities? Along those same lines, I've been thinking a lot about, just funny that you mentioned the child welfare. So in public health, we also have been starting to organize more with maternal child adolescent health, and thinking about early childhood and housing, and developing a set of recommendations for intervention solutions, because of we know the impact of that, right, for children, or especially 0 to 3 in their housing. And I often think of similarities with other vulnerable populations like older adults and disabled people. How do we really kind of unsilo ourselves to think about advocating for more protections for these groups?
Great.
Hi. In terms of what we're doing, in terms of the I Wish, I would say helping them to navigate all the resources out there. There was someone that spoke about having things in one place, but helping the seniors to navigate all the resources that are out there to keep them aging in place. I think that's one thing. And just utilizing all of the resources and the things that are in the community.
Great.
I'm sorry, can you actually repeat? I was listening to others and I kind of lost.
I can. So, what does your agency look forward to in the future? And as you have indicated many times, upstream is better for the kinds of services you can do. And then what's most needed to support that? Is it collaborating with others differently? Is it what will make us all more impactful together?
So I think for us, the most exciting thing that's happening looking to the future is exactly what's happening. The Council for Age-Friendly Communities. I know Daybreak, we're doing a program, rapid response case management, with some of the local emergency departments to kind of see if we can intervene upstream. I think I've only been around 10 years, so I still feel kind of new to this, but it feels like the conversation has evolved, and we're understanding between healthcare, between social services, between legal, we're really starting, I think, to speak the same language in terms of needing to work together more effectively, needing to be much more upstream. I still feel, even with collaboration and even with the progress we've made, there are times where I feel like to get my client service, it has to be me calling, and I'm calling in a favor. And that has to change. It just has to be that the connection's automatic, that the research, that there's a there. I know we have a lot of conversation about there's really two sides of it, and I think progress needs to be made on both in terms of, and I need to know that, when my client needs X or Y, or needs food security, or needs help with public benefits application or a housing app, that there's a there that I can confidently refer, and that it all exists, and that we're all interconnected in a way that it's not Jim calling in a favor, it's just the way the system works. In terms of what we need, I hate to be kind of basic about it, but it's resources. There are so many good programs in this county. There are so many people. Dr. Bamberger was talking about kind of what fires him up. What fires me up is going to meetings like this and seeing people who care as deeply as they do and are putting in so much effort to do the right thing by older adults, and doing an amazing job at it. And really, if it comes down to, honestly, my agency, it's just a resource issue. The work isn't, we're good at the work we do, and we just do not have, when we're talking 1.5 attorneys for the size of this county, the reality is that just doesn't work. So basically, it's resources.
Agreed. We're going to turn it over to the audience now for questions and answers.
I have a question. I'm Donna
Great.
Murphy from Allen Temple Arms, Human Good. We have the integrated wellness and supportive housing. That's great that that's one resource. We want so many other. I want to reiterate what Dr. Ratner said. We need one place where people searching for housing can put their name on a list. I think we're so fortunate, that we do in Alameda County have so many resources, but I do want to always remind us that there's no one that works for all.
Right.
Having housing that we can share is a great idea. It works for some. My mother had dementia, so she had somebody in her house, and then it didn't work because she couldn't, navigate that. But we need affordable housing. We need to be these creative models. Nursing homes do have some extra beds. We need to be able to see if that can be an option. So not just building housing, but I really want to reiterate Randy's point. Every time I go to a meeting, city council, state, local, wherever I'm at, there's not a lot of older adults or people talking about older adult issues. We're not at the table. So all of these incredible people in this county, we have so many incredible people here. We got to be out there. We got to be the voice. We got to talk about these older adult services. And we're lucky we have this council now. So there's a lot of things that could be happening. I think this was more of a statement than a comment, but I just want to appreciate you all.
Back there?
And just a quick comment. There's a couple opportunities coming up. I know the census group is meeting, and we need to have older adults, making sure that we're talking about older adults at the census meeting. When disaster planning comes around, we need to make sure that, someone representing the interests of older adults is at that table. So I think it is kind of broadening our perspective, too, of what's the appropriate table to be at, or where should we be. It's kind of everywhere.
Hi, Lisa Malol, Rebuilding Together, Oakland East Bay. Hi, everybody. Upstream, stopping people that are homeowners from being red tagged so that they don't lose their homes, and helping them to deal with deferred maintenance in advance before you've got this huge swell of problems before we get into reverse mortgages and so on. Under-resourced. Even with the leveraging that we do, and I'm always wondering, and it's really a question for the panel, how do we collectively think about those populations? You're not seeing them on the street yet. Mm-hmm. How do we want to think about that, and how do we want to think about resourcing that? That's the largest part of what we do as an organization.
Do you want a response? to that?
Yeah, she does.
Well, I'm going to shamelessly borrow from Linda and Robert, who were on the previous panels. You know, we actually, I mentioned in my 6 minutes that we have this housing homelessness committee focused on older adults. So we sort of talk, this is my version of the words that were used, is we talk a lot about us as kind of social human services people and the need to have like rapid response programs. They're very built on social servicey type stuff. And I think to the question, there's really a need to have sort of a housing rapid response experts that aren't really the social service people, that the moment something like that happens kind of has probably a legal wing and sort of some housing expertise to really jump in there in addition to social services to deal with the kind of complexity of housing to make sure housing is dealt with. So that's a huge need, and there's not really a there, and I think it's going to be a combination of some piloting and probably some state and federal sort of legislative activity, and I think that's another thing we haven't talked much about now, but the need to really talk about legislation, to really kind of get organized and focused on some legislative asks.
And I think, I think it's thinking innovatively. I know for housing community development, the program that Linda was talking about earlier was starting to address, I think, one of the barriers we were seeing as to why older adults weren't participating in the program, meaning that if there was risk of the next generation not being able to stay in that home and live from that home, that really was a barrier to an older adult wanting to participate in that. So then understanding and starting to address that with, if that next generation qualifies for the loan stays on and it doesn't trigger repayment. Stuff like that is thinking kind of more innovatively about the barriers that are stopping, older adults from utilizing programs like that, which are desperately needed, but it's thinking a little bit broader. And so, I think that's a really good example of innovating in a way that's going to hopefully really increase utilization for a lot of our older adults.
Great. Back there.
Oh, no point. My name's Karen, the City of Fremont, but as a service provider, one of the challenges is the definition of older adult, right? So we can have somebody who's 59 and a half and they're not eligible for a service that starts for 60-year-olds. So the eligibility isn't defined by their need, but by an age. So it's great that we have this, specialized group, older adults, but then it also is complex because we don't assess service need by function or situation.
So does anybody want to tackle that one?
Well, Karen, and can we also you're not only just from the City of Fremont, you're from the nationally recognized award-winning City of Fremont for the aging work you do, so thank you for City of Fremont, Karen. I think there's a couple proxies. This gets to federal and state funding. The Older Americans Act says 60 and over. If you're 59 and a half, you're ineligible. Medi-Cal, you have to, if you're 65 and older, you can get enrolled, and if you're under, you have a different, there's all kinds of dimensions there, but I just wanted to throw out one other proxy that we haven't talked about now, which I think everyone would agree is a huge issue, and that is, it used to be the haves and the have-nots kind of narrative, and have-nots would have a low enough income that they'd be eligible for a lot of public assistance services, but then there's the people who are just above the poverty level, and this is becoming a massive crisis. So in addition to the age proxy, you have the Elder Economic Index of everybody who is just above, and you can't afford share a cost with Medicare. And so that's a growing crisis that I didn't hear mentioned, but it's just another confounding variable that's massive. When I heard you say that, I thought about that point. We just have more and more people coming. They're not eligible for Medi-Cal or CalFresh, but they're still struggling mightily.
I just wanted to speak to shared housing again, and just to say that there is, I just felt like we were being slammed about the shared housing here by this attorney. And shared housing is live and well, and it's we've got HIP housing over in San Mateo County. It's been operating for 40 years over there, and they're operating very effectively. And it's so effectively that they have another office in Fremont. And we don't have that here in Alameda County, and that's what we're trying to do. We're going to mirror what they're doing there, and if they're working and they're effective, I don't see any reason why we can't be effective here in Alameda County as well.
Just to say it again, I'm totally pro shared housing. I'm just in favor of going slow and making sure we're doing it the right way. So, absolutely, I am pro. It is a solution that's out there.
One more question? I guess we have time for about one more question. So.
Somebody who hasn't gone, maybe?
Somebody who hasn't gone before?
Yeah, I'll see.
Quickly, Elsie Kuzel from Alameda County EMS. I have a question. What kind of efforts are being made towards supporting and growing the workforce to take care of this in-home support? Because I think a lot of that is, in my terminology, I also work preparedness, left of boom. You call it upstream, I call it left of boom, right? So I think that many of the people that I respond to on the 911 system, if they just had some better trained people to help them with their day-to-day, their ADLs, then they could stay in their home a lot longer. And to somehow create policy that it's not something they're doing while they're doing their master's course, that they could actually make a living and this is their calling and they could live a life with that type of work. Thanks.
So who wants to tackle that one?
Were you talking about in-home supportive services proper or just generally any kind of in-home care? I'll just mention about in-home support services proper and the issue of resources. So we have 24,500 IHSS providers. We get $50,000 to provide training to that cohort. So it's part of this discussion is the resource and on the in-home supportive services program, just so you know, which was found really in our backyard in Berkeley from the independence movement. It really was organized around the sort of policies and principles of disabled in body but able-minded, and I want to pick who touches me, and I don't want government getting involved in training. I want to train my provider. The problem is the regulations are built upon that foundation, and it really doesn't work well for the older adult population who has complications, and we're prohibited as a county from intervening. But for the $50,000 we have to offer free trainings to those who want to show up, and we use that money to put gift cards out, and most of the time most people don't show up. So I just want to put that honest reality on the table, and it's an issue.